I want to tell you something, doctor, about orthodontics for children, for growing children. It's extremely popular to be out there teaching people to do treatments for these children that seem a little bit easier, a little bit less education sensitive, a little bit less practice interrupting. And what I mean by that is things like functional appliances, for example, of all sorts. Lip bumpers, very popular. What about lip bumpers? What about trainers? What about all sorts of things that we might put in the range of functional appliances, meaning removable appliances? It's easy to show that and to teach that in a very quick and efficient way to dentists who want to do something to help children. And that would most likely be you, as it is me. However, let me explain to you that functional appliances, newsflash, require compliance. Now, think about your child patients. Think about any of your patients for that matter, not just your child patients. How many of them are compliant with hygiene, with plaque control? How many of the child patients have parents who see to it that they're compliant with both brushing and flossing, controlling the bacterial acids in their mouth? You see, if you don't have a patient or parent who can come to that point with compliance to make that work for that child, then chances are really, really high that they're not going to be compliant with a functional appliance. So while it may be something that's easier for a non-orthodontically trained dentist to offer, is it going to be effective? Is it going to end up making the child better off? Is it going to be a good expenditure of the parent's money? These are the questions that you need to think about and answer. Now, for me, I just want to tell you that I found long ago that compliance was waning very quickly from 20, 25 years ago to now. And so while we might have had even headgears, and I know, oh my, we don't use headgears, okay, but the point is it's the same need for compliance, whether it's an intraoral or extraoral functional appliance. So the reality is that that's where we run into the trouble. We have a new generation or two of child patients and parents who are not going to come to that level as they did 20, 25 years ago for the most part. And there are a few that will do it. So if you have one of those that look to you like they're a great candidate, and I've had several, let me tell you, I have a fantastic functional appliance to teach you. And that's something that you can learn. It's something that it's easy to do for sure. It puts the onus on the parent and child, of course. And I will be glad to show it to you. Don't worry about it right now. It's in the phase 1 session of our Elements seminars, and it is just a dynamic, wonderful way to treat a child if they are going to be compliant with their parents' help. So we can go to that. But the reality is most functional appliances, removables, are not the greatest of ideas for most patients. So instead, you have to think about, would you like to get comfortable with actual fixed appliances? Because guess what? That way, you're doing what needs to be done, and you're only asking for compliance and plaque control, which obviously is hard enough to start with. So something else to think about as you consider how much orthodontics you'd like to learn. Think about that. Call us, talk to us, let us know how we can help. There's a lot you can do for child patients, but I would avoid the removables as much as possible most times. Dr. Chris, signing off.